I'll start a little bit the the backstory. My wife and I had our firstborn daughter, Kate, in January 11th, 2022. It was just coming out of the Christmas season. We were quarantined because Omicron spread was widespread across everyone's holiday travels. But she was born on that bitter cold day. Everything went perfectly. Her app scores were great. She was healthy. In fact, we were even discharged from the hospital early. She was a happy, beautiful baby. I know every parent's biased, but she was born pretty much with, this is about the only picture with her eyes shut, was when the photographer came. Everything really started going well. I was able to return to work. My wife everything was going well on maternity leave. Until about 2 months old, we started noticing, well, babies are starting to get a little bit more wiggly. We asked about it at the pediatrician. It wasn't necessarily a huge concern at the time. We thought it was a bit of reflux and other baby-like things. And at the end of the day, every child's kind of unique. Fast forward, life gets crazy. You're blurry-eyed and tired with a newborn who's up all night. And while you try to do your best to monitor things, it's always hard to keep tabs on things. And if looking back now after her diagnosis, I think there's something interesting that you dig through pictures and see, should we have known something? And I think the next picture's, fairly telling for that. So a little bit about SMA. So, our experience in the disease is it's a rare genetic disease that occurs in about 1 in 6,000 to 1 in 10,000 babies. When you first Google it, I remember thinking, this is, if I were to picture a parent's nightmare, this is pretty much it. Your child is born totally normal in many cases, but they're missing a gene that allows their muscles, their vital muscles, to basically regenerate and maintain strength. And slowly but surely, incrementally over time, the muscles begin to atrophy, and eventually largely impacting the respiratory system and ability to swallow and things like that. Quite frankly, previous to treatment, if you Google it, and this is the most terrifying part of this, is most babies do not live past their second birthday. In fact, recent studies said that most 95% did not make it past their second birthday. I'll talk a little bit about our diagnosis. The reason I think this picture is significant is I look at her left leg. At the time, we had no idea how much that would mean to us to see what they call anti-gravity movement. And she's picking that leg up with her own strength through her core and trunk. Little did we know, she was never super wiggly, but just slowly started losing that ability. We started noticing concerns as my wife was ending maternity leave. We were really getting to enter daycare. We had a conversation with daycare and our pediatrician, how we were not totally comfortable with her inability to hold her head up, and started getting concerns really after her 3-month mark with the developmental check marks, where she should be holding her head up during tummy time and gaining more and more trunk control. Well, it didn't seem like she was regressing at the time super quickly. She just didn't seem to be making progress. So we were trying everything. We were referred to early intervention, but we just couldn't necessarily quite figure out and peg down exactly what it was. If we go to the next slide here, this is one, again, at the time we didn't realize, the main sign of SMA is floppy baby. And we didn't realize it because it was our baby and it was happening slowly. But looking back in this picture, this was Master Saturday. And, she's really, at this point, started to lose a tremendous amount of her core strength. It was really starting to worry us more. But it just seemed like Kate, that was how Kate was. We did finally, at this point, shortly after this, we really pressed our pediatrician. We got an appointment and got a referral to neurology. At that point, we were about to leave on a trip to Minnesota for her baptism, as well as to her great grandmother's 100th birthday party. We asked, do we go or do we stay? And we, after discussion with the pediatrician, we referred to go. The call Monday morning, bright and early, from the neurology department at Children's National should have been an indication that this was far more urgent than I think we suspected. At the time, we didn't know what SMA was. If you look at hypotonia or a lot of these things, a lot of things are cerebral palsy related or injury, all these things. But as we started looking in that, and we had our upcoming neurology visit, we started looking, down a deeper internet search. going through her symptoms and trying to eliminate on our own some of these risk factors. She was not a tough birth. She was not a twin. She was not premature. So many of these other risk factors that would contribute to that just didn't make sense. It didn't line up for why she would be behind. So while we were in Minnesota, my wife and I both stumbled across SMA on the internet at the same time. I was reading a NIH study talking about a baby with similar circumstances at the exact same age. At the end, they got to the conclusion that it was SMA, at which point I started looking at videos on Cure SMA. And as soon as we started looking at some of the diagnostic indication videos that they share in that organization, it just hit me. We walked upstairs at about the same time, and I said, have you ever heard of SMA? And she says, so, you think that's what she has too. We went into panic mode. At first we realized as we started digging, oh, great, this was part of a newborn screening panel. There's no way that she could have this. This was ruled out. And then we looked at the Cure SMA website and realized that despite at the time of her birth, 97% of U.S. Newborns being screened for that, she was born in the state of Virginia, and Virginia had not implemented the newborn screen at the time. That was confirmed later when we saw a press release from Governor Youngkin's office applauding the newborn screening just a matter of days after she was born. We thought, well, maybe she's seen a pediatrician in DC, and that was not the case either. Actually, in fact, DC is just finally implementing the rulemaking to implement the newborn screening, despite the Department of Health having a website that says it's been passed. Just as Virginia had been passed, the implementation lag time is significant. And even today, a baby born in DC is not screened for SMA in the newborn screening. So, your heart sinks. In all this diagnosis, and you really go into panic mode. And it's not something I'd wish on any parent, but we do get to a little point of hope when we got to treatment. It's certainly a long walk to get to the, Kate's story and diagnosis, but, as soon as we had an appointment with neurology, this is where the healthcare system, in our experience, showed how exceptional patient care can be, both in terms of innovation and people. Within the first 15 minutes of our visit to neurology, we were almost instantly diagnosed visually in terms of her symptoms. We were referred that afternoon for blood work, not only to confirm her diagnosis, but also to confirm her eligibility for gene replacement therapy. Within a week, she was not only diagnosed, had seen every specialist at Children's National, was set up with patient advocates within the children's system, through Novartis, the pharmaceutical company, through Cure SMA, the association, on every single angle. We were frankly inundated with answers to any questions we had. And fortunately, she was able to receive gene replacement therapy that really halted the regression of her progress. Since then she's been doing better. We really, have to take kind of an optimistic view when we've, approached this disease in that way. She started to show some progress in terms of her mobility. Her pulmonary function has really improved significantly. But as the congressman mentioned, she's the treatments are most effective within the window. The gene replacement cannot undo what the harm and the regression that was done for the first 4.5 months of her life. That's just something that modern medicine can't rebuild those motor neurons and begin them to fire again. As such, she's additionally requiring additional treatments. In fact, another one this morning. So she's now received 2 of the 3 FDA approved treatments for SMA. And quite frankly, the biggest frustration in all this is the what could have been. You see online, the SMA community is fairly small, all these success stories of babies that were quickly diagnosed or the first of the newborn screening, and received Zolgensma, the gene replacement therapy, within a week of life. And quite frankly, in most cases, they're progressing almost normally. Not saying that things aren't challenging for them, but the contrast of what their quality of life will be versus what our Kate's will be is tough to really think about as a parent. And today it's tough, but we know tomorrow is going to be tougher, and those decisions, those first couple of months of life, are going to impact her for her entire life, not only for cost of the healthcare system, her quality of life, the contributions that kind of societies we're going to have to do as a community to hold her up and provide the best quality and mobility and everything else we can for her. And it's crazy that everything in the healthcare system works so well, but without that first piece, the newborn screening, you don't get through the door. In that you have to be through the door and have that access and that understanding of what's coming your way to be able to do that. So it's interesting. In our experience, the SMA community, the U.S. is the best place to have SMA. In fact, we found a lot more community with parents who are diagnosed symptomatic in the UK, Australia, and other places around the world where the newborn screening is not as prevalent, because they're still fighting to catch up where we're at. And I think that's something we want to keep our foot on the gas on, making sure that we have the best, most innovative, and the fastest newborn screening system to make sure that we can take advantage of all the modern advancements that are continuing to come out. And it's if you ever subscribe to the FDA approval list, it's always so fascinating to see what's coming out through the approval pipeline for every rare disease out there that's going to change people's lives. You just need to get through the door. One thing I'd also add is just it's frustrating as a policymaker to see things on people's desk. I'd say that to all staff on the line. You don't think your decisions impact everyone's lives in government every day, but there's always a face behind every story. And what you do is important. The decisions make you important. Working hard on the effectiveness of our government is important. So thank you, and continue to. I hope Kate can be a reminder of that.